I'm Damien Goldberg. What I wanted to talk about first is the clinical trial Ocular Science 1.0. This is a multi-center randomized observer mass prospective study where we compared preservative-free versus the current multiple drug therapy of Vigamox, Predfortate, and Alevro. Primary eligibility of this was patients undergoing unilateral uncomplicated cataract surgery. Total of 80 patients are followed. And what we wanted to do was compare to see the safety and efficacy of Predphosphate, moxifloxacin, and ketorolac 4 times a day for 2 weeks, then 2 times a day for 2 weeks, versus Vigamox and Predfortate 4 times a day for 2 weeks, then 2 times a day for 2 weeks, with Alevro once a day for 4 weeks. We set out at first to see if it would show non-inferiority to conventional medication. We were surprised to see, with 90% confidence interval, that actually at day 7, it cleared the inflammation by 50% compared to only 27% with conventional therapy. And at day 14, it was 88% versus 81%. At about a month out, both were pretty equivalent. This was another way to look at the data is to look at this bar graph and looking at the confidence interval. You can see that it performed better at day 7, day 14, and day 30 compared to conventional medicine. So this was important because this is the first time we're seeing a compound combination medicine not only can be safe, but was as effective, if not a little bit sooner, reduction in inflammatory clearing than conventional medication. Another thing I wanted to introduce was the new line of glaucoma medicines Ocular Science is launching. First, these are the post-op medications. There are 3 new post-op medications, and then a new intracameral medication.
Ocular Science is a company that is a compounding pharmacy. And if you have a patient that's, I call this sort of confusion, maybe a little bit of a lower health literacy, they can't remember which drop is when, or they come in and they say, I'm taking these 3 drops, and they've got 3 bottles of latanoprost. They're taking it to the same drop. I've seen it all. I've seen people mix up Predforte and Timolol because they get the cap on the wrong bottle. You can take your drops, you can take latanoprost, Timolol, dorzolamide, brimonidine, put them in 1 bottle, compounded. Because there's a lot of high copays, even with generics these days, the compounding price is probably going to be less than their generic copay. It's a bizarre thing, but that's the reality. There's price gouge. There has to be price gouging. And so you can simplify life for patients. And we all love fixed combinations. The reason we don't have 4 in a bottle is because the FDA requires a really carefully done study to do that and have it FDA approved. But we know all these molecules coexist in bottles because they're all out there in one combination or another. And so this is a way of simplifying things for patients, putting it all in one, and letting them just have a reasonable quality of life with 1 bottle in their hand.
Lastly, the area I think Ocular Science is most excited about, and I'm excited to present, is a new dry eye therapy, amniotic cytokine extract. We know that dry eye is a chronic progressive disease, and there gets to be an issue with the way the immune system works on the surface of the eye. Current medications that are available usually only work on 1 pathway of reducing inflammation. ACE will have the ability to work on multiple pathways because it's loaded with multiple growth factors and multiple cytokines that promote good healing. ACE is a cryopreserved drop stored in the common freezer and will be dosed twice a day. ACE has reduced dry eye symptoms as soon as 2 to 4 weeks. And I'm excited to tell you we'll have more data as a U.S. multi-center trial that's currently underway will be completed and will be presented at ASCRS 2017.